Hi, I'm Dr. Nicholas Mercer, physical therapist and owner of You Improve PT in Oviedo, Florida. I wanted to welcome you to the End Back Pain Seminar and congratulate you on taking your first steps towards finding a solution for your back pain. Not a band-aid, a solution. A long-term solution so that you can get back to the active, healthy, happy life you want without back pain or sciatica. Debilitating, frustrating, nagging pain that makes every aspect of your life more difficult and less enjoyable. I know how you're feeling right now because I've been there as well. I had struggled with back pain and sciatica for years, and it kept me from exercising, working, playing with my nephew. It basically interfered with every aspect of my life. Now, you're probably watching this seminar because you've tried some, maybe a lot, of different things to help your symptoms, and maybe they've worked a little bit, but you're still struggling to do some of the activities that you used to do. You might even be considering surgery since nothing you've done so far has really given you significant long-lasting relief. Now, pain medications and injections may have helped you a little bit for a short time, but you're still struggling with your pain. You may have even tried acupuncture, chiropractic sessions, or even other forms of physical therapy. You're in a very difficult situation. Not much has helped, and you feel maybe stressed, anxious, or depressed, unable to do some of the simple tasks that you used to, take care of your loved ones, or enjoy physical activity. I've been there too, and to put it simply, it sucks. What I'd like you to do now is take a deep breath and focus on now. This is very important because this seminar is your first step to finally getting long-lasting relief from the back pain, sciatica, or maybe both that is holding you back from your life. The best part? There are no unnecessary surgeries, no injections, and no pain meds involved. After this seminar, you will have a better understanding of why your back hurts, why everything you've tried hasn't really had long-term results, and most importantly, the next steps you should be taking to get those long-term results you're seeking. So, let's talk about how you got into this situation. There are a few ways that back pain typically begins and progresses to the point that it holds you back from living your life. For many people, perhaps yourself, it starts with some on and off achiness. In the past, when you were younger, you could probably go to sleep with back pain, wake up with no back pain, and continue on with your life. But over time, it became more frequent, more intense, and longer lasting. And now, maybe it's pretty constant. The pain's worse, and it's pretty relentless. There isn't really much that makes the pain better. Maybe it gets worse after a long day of sitting at your desk, after working out at the gym, or during long walks with your family. Regardless, nothing seems to help the pain too much, and you definitely can't sleep it off anymore. If this sounds more or less like your situation, you're in the right place. For others, maybe there was an initial injury, often a car accident, a fall, or a sudden pain when you lifted, twisted, or even sneezed the wrong way. Initially, the pain was severe and you couldn't move. You may have seen a physician who gave you some medication to help with the pain, and it helped. You got enough pain relief to get out of bed and get back to your everyday life, more or less. But you notice that the pain will creep up if you start becoming more active or after a long day of work. You may even notice there are certain movements that tend to increase your pain, so you avoid those movements as much as possible. But now, you get a lot of stiffness, achiness, or even occasional sharp pain in your back. In addition, if you're dealing with sciatica, this pain could radiate down the back of your hip and leg, even causing some numbness and tingling in your foot. If this sounds like you, you're also in the right place. Now, everyone's story is different, but these are two of the most common stories I hear. So first, I want you to know that you aren't doomed to suffer with back pain forever. Second, I want you to know that back pain is not a normal part of aging. Pain is not normal. Your back pain isn't caused just by getting older. However, as we age, it is increasingly important to maintain the health of your back. So, while back pain is more common as you age, it's not a normal part of aging. And there's hope. Your back pain can get better. Now, you may be thinking, but I got an MRI or X-ray and my physician told me my back was bone on bone or just jacked up. This is something I'd like to address. Research has actually shown that back pain and MRI results are not very well correlated. Researchers looked at adults who were having back pain and people who weren't having back pain. What they found was that a lot of people with back pain did not show much wrong on their imaging, and vice versa. Many people without pain had a lot of abnormalities in their spine. So what the heck? You see, when your back hurts, many times your physician wants to see if there is something wrong on imaging. If they see an abnormality, it makes sense to assume that the abnormality is causing your pain. The problem is that pain is not always associated with tissue injury. Pain can stem from many sources, but we can't see pain. And indeed, these injuries can cause pain. However, we have to be careful when considering surgeries and injections. I've seen too many patients undergo back surgeries and come out of it with the same or sometimes worse pain. In addition, these imaging techniques do not show movement, muscle spasms, and certain types of soft tissue abnormalities, all of which can be treated with proper physical therapy, manual techniques, and exercise prescription. So you can see why the standard methods of finding the source of your pain are flawed, and furthermore, why the standard methods of pain relief are only temporary and less effective. Now, you may be wondering why the exercises your physician, chiropractor, or even another physical therapist gave you didn't help much with the pain, or maybe even made the pain worse. A lot of these exercises are simply pulled from a back pain worksheet. They're not custom tailored to your specific deficits. In addition, if you have abnormal soft tissue, muscle spasms, or limited joint mobility, these exercises can actually cause more damage. Simply put, if we don't get your muscles and joints moving properly, first, moving more is going to hurt more than help. Most of the time, simply restoring the body's ability to move properly, the way it was made to move, and becoming stronger and more mobile results in that long-lasting relief from back pain. And ultimately allows you to spend the rest of your life doing what you love to do instead of worrying about your back pain acting up. And that's the whole reason you're watching this, isn't it? All right, so let's get into where we go from here. Remember, I said everyone's situation is unique. What works for one person with back pain may not work the same for someone else. What you need is a complete solution to your specific deficits, which comes from proper movement evaluation, hands-on treatment, and lifestyle changes. Unfortunately, many healthcare professionals are unable to provide this to you. They have way too many patients, often having to see multiple patients in an hour, and are inaccessible when you really need them. And that's precisely why you haven't been able to get the care you need. Well, at YouImprove PT, we refuse for this to be the case. We strongly believe that you deserve one-on-one, hands-on treatment from a doctor of physical therapy for the entirety of your session. This is the best and most efficient way to get back to that active, happy, long life you want to live without worrying about surgeries, injections, or taking pain medication every day. That's why we're offering you a free discovery visit. You'll be able to visit our office, chat with a doctor of physical therapy about your problem, and really make sure that we are the right fit for you. If you aren't quite ready for that, we completely understand. That's why we also like to offer you a free phone consultation. So in this quick phone call, we'll get to learn a little bit more about you and tell you if PT is right for you or if there are other steps you need to take to get the best care for your problem. Either way, we want you to know we're here for you to help you the best way that we can, because we've seen firsthand the change that has been made in many of our patients' lives. Just take a look at some of the testimonials on our website, full of patients who have successfully ended their pain with our specialized treatment. And we really want to make that happen for you. So much so, we've even written a free report on ending back pain, which you can download at youimprovept.com. Simply go to the section for back pain, enter your full name and email, and we'll send you a free copy of our report on ending back pain, full of tips to help manage the pain today. Now, it's not a complete solution for your issue, but you should experience a little bit of relief by following those tips. So, I'd like to thank you for taking the time to better yourself and find a solution for your back pain that will give you the life you want to live. If you have any questions, please feel free to contact us via phone, text, or email. We are here to help, and we look forward to meeting you soon.